Okay, so let's go down a bit deeper into type 1 diabetes. Let's start with some repetition first. So, insulin dependent diabetes. So, patients that have no insulin production from their pancreas, so an autoimmune disease that destroys the beta cells, um, results in no insulin secretion. Well, that is typical in children and younger adults. Okay, so think of type 1 diabetes as really a younger person's disease. Type 2 diabetes is going to be typically an older person's disease. Okay, so, and when I say older, it kind of depends on some factors such as weight gain, obesity, because that's going to create insulin resistance. Okay, okay, so let's go back to type 1 diabetes. So in type 1 diabetes, the symptoms are going to occur very rapidly because there's a sudden loss of insulin from this autoimmune disease on the pancreas. And when insulin disappears, a whole lot of things happen. Okay? First thing that's going to happen is serum glucose will become high. Since the insulin is not present anymore, the glucose has nowhere to go. Okay, it can't go into cells, it can't go into the liver because insulin is required to help glucose turn into glycogen. It can't go into fat cells because insulin helps glucose go into fat cells. So there's tremendously high serum glucose levels. Okay. Now, insulin, the lack of insulin is going to cause a couple of things. The body is going to sense the fact that cells are unable to get insulin, are unable to get glucose into the cells. So the fat cells are going to try and help by breaking down fatty acids. Okay? So even though there's lots of sugar in the bloodstream, they can't get into cells, and so there's communication saying, you know what, the cells are starving. They're not getting any glucose, even though in reality there's lots of glucose in the plasma. Okay, so the fatty acids start to break down in the fat cells. And when you break down fatty acids, you get byproducts called ketones. And they're acidic. And that is why in type 1 diabetes with no insulin, you get diabetic ketoacidosis, because the fat cells are now saying, I'm going to help out, I'm going to break down the fatty acids to provide energy, but in actual fact, they're making the blood acidotic, right? And as the pH of the blood starts to go lower and lower and lower, patients become extremely ill, okay? So they develop a metabolic acidosis, and on top of that, they're hyperglycemic. Okay. And of course, because of the hyperglycemia, they're dehydrated because they're losing so much sugar in their urine. Okay. So let's talk about diabetic ketoacidosis. So the fat breakdown occurs due to the absence of insulin. So the fat cells, when there's insulin around, the insulin communicates with the fat cells by saying, you know what, I don't need you to break down any fats. In fact, I want to provide some sugar to you for storage. Okay? When there's a complete lack of insulin, that's an indication to the fat cells that I need to break down. Okay? So let's see what happens in DKA. Well, first of all, there's hyperglycemia because there's no insulin. And that results in this diuresis in the kidney. Because the serum glucose is so elevated, it's now leaking into the urine. So it's going straight through the nephrons. Not a lot of it can be reabsorbed because there's just too much glucose, and it goes into the urine. It takes fluid with it. So there's the polyuria, right? I'm making tremendous amounts of urine. If I'm making tremendous amounts of urine, I'm going to become thirsty. And I'm going to be hypernatremic. So I'm thirsty, I'll drink because I'm getting dehydrated. So there's the polydipsia. If I'm losing sugar, I'm losing energy. I'm going to be hungry. I better eat. I'm having a sensation of hunger, polyphagia, eating more. Okay, so that's all caused by the high serum glucose. Let's look at the ketones. So the ketones, which are the acids, are due to fats and proteins that are breaking down because of the lack of insulin, right? So all the fat cells in the body are saying, gee, if there's no insulin around, that must mean that the body needs energy from me. So I'm going to help out by breaking down fatty acids, okay? When in actual fact, there's loads of energy in the bloodstream in the form of glucose, but it just can't get into cells, okay? So the ketones cause acidosis, which makes us very sick. As our pH starts to drop below 7.35 and then lower and lower and lower, we get very ill. The lungs start to help out by breathing faster, Kussmaul breathing, to try and blow off CO2, which in actual fact is blowing off some hydrogen ions. Remember, hydrogen ions and HCO3 combine to form CO2 and H2O. So the lungs can breathe faster to blow off some of the hydrogen ions. Okay? So in ketoacidosis, what could be some, in diabetic ketoacidosis, what could be some typical lab values? Well, a blood glucose greater than 250, a pH, typically much lower than 7.3, but let's just say 7.3. And a bicarbonate less than 18 would be an example, because the metabolic acidosis is consuming some of the bicarbonate buffer in the bloodstream. So you get a lower bicarbonate, okay? Okay, so remember, type 1 diabetes is where you get diabetic ketoacidosis. And the reason for that is in type 2 diabetes, you have insulin, right? So the insulin in type 2 diabetes is telling the fat cells, you don't need to break down. It's telling the liver, you can store more glycogen. The problem is that the cells are resistant. They're not sensitive to the insulin, and that's why you have hyperglycemia, high glucose in the serum. In diabetic ketoacidosis, where you're totally insulin dependent for survival, if you stop taking your insulin, or you develop type 1 diabetes suddenly and you don't know it yet, well, you have zero insulin in your bloodstream. So the whole body is actually going to think that it's starving because there's no glucose going into any cells around the body. So it's basically cellular starvation. And that's why the fat cells try to come to the rescue by releasing, by breaking down fatty acids to try and increase serum glucose. But in the process, not only can they make the serum glucose worse, they release ketones, which are acids. Okay? So this is really a problem of type 1 diabetes. And this is why people get so sick with type 1 diabetes when they don't take their insulin. Right? So this is really not a type 2 diabetes problem. And what makes people so sick? In diabetic ketoacidosis, it's the acid, right? It's the circulating metabolic acidosis. And they typically come in very ill, vomiting, abdominal pain, confusion. They're very, very sick because the pH has been altered in the bloodstream. Okay? So take a look at this. I would say the most important number on this slide is look what's happening to the pH as somebody gets sicker and sicker because they're breaking down their fatty acids, and by doing that, they're making more ketones. Look at the pH, 7.25 to 7.3. You're not too sick. Severe DKA, you've broken down so many fatty acids and produced ketones, your pH is less than 7. Well, that's at a dangerous level, right? So at around 6.8 of pH, that's starting to be not compatible with life, okay? So, and you can see from their neurological function that the acidosis is now causing not only just confusion, such as in moderate DKA, but stupor and coma because of the metabolic acidosis. So it's really not the high sugar that's making them very ill. Sure, the high sugar is making them urinate a lot and drink a lot and eat a lot, but it's the acidosis that's making them sick. Okay, so let's just talk about insulin a bit. So a type 1 diabetic is dependent on insulin shots, right? They can't take pills to treat their diabetes. They need insulin replacement, okay? So what can happen with insulin replacement? Well, if you happen to take too much insulin, or you skipped a meal and you took your insulin, you can become hypoglycemic, right? So the insulin that was injected subcutaneously is now having an effect on serum glucose, and it's forcing it down because the glucose is going into cells, right? So this can occur from excessive insulin dose, okay, that we just spoke about, or it can happen because you took your insulin and skipped the meal. Or it can happen that you took your insulin, you had a bit of a meal, but you had a lot of activity. You went and did strenuous activity, which consumed more glucose, and led to hypoglycemia. Okay, so now let's look at the symptoms of hypoglycemia. So I mentioned before that the body definitely doesn't like to sense dropping serum glucose below its normal levels, because that means the brain is going to receive less glucose as a nutrient. And the brain gets very nervous when serum glucose starts to drop, okay? So what's going to happen? So symptoms of sweating, well, that's your sympathetic nervous system turning on, warning you, I'm going to make you sweat. Tachycardia, nervousness, and at the same time, by the way, the sympathetic nervous system is going to the liver and telling the liver to break down glycogen to glucose, to bring up the serum glucose, okay? Now, if the symptoms, if the hypoglycemia continues to get lower and lower and lower, the brain's going to start to turn off. You're going to get confused. And finally, you're going to have various degrees of reduced level of consciousness, since the brain needs glucose as food, right? So all of these symptoms are explainable if you understand what's happening as the glucose level is dropping in the blood. So the sweating, the nervousness, the tachycardia, the paleness, that's the sympathetic nervous system turning on, trying to warn you, and also release glycogen into glucose in the bloodstream. The reduced level of consciousness and the decreasing the increasing confusion and the decreasing level of alertness is the brain saying, I can't stay alert if I don't have glucose. Okay? So the autonomic nervous system is definitely activated um, when your blood glucose level starts to drop. Okay, so that's very protective. Not only is it making your heart race and making your blood pressure go up and making you sweaty and pale and nervous, it's telling you your sugar is getting too low. Do something before you go unconscious. And at the same time, remember there's receptors in the liver for the sympathetic nervous system to convert glycogen to glucose, trying to elevate that serum glucose. Okay? And that's partly why we don't use beta blockers very much in type 1 diabetes. Sure, they're effective medications to reduce someone's blood pressure, right? We use them all the time to reduce someone's blood pressure. But what happens is if you're a type 1 diabetic and you're on beta blockers, well, what happens if your sugar starts to get too low? Well, all the receptors for the sympathetic nervous system are being blocked by beta blockers, so you're not going to get the same warning signal of hypoglycemia. So we try to avoid beta blockers in type 1 diabetics. Okay? And we always remind people to carry some kind of sugar or glucose with them in their pocket if they're a type 1 diabetic, because they typically get a warning before they become unconscious from hypoglycemia. Okay, so let's look at a term, pre-diabetic or impaired glucose tolerance. So this is a term that's more reserved for type 2 diabetes. So remember, in type 1 diabetes, you have no insulin. You need insulin replacement. You're not going to be pre-diabetic. You're not going to have impaired glucose tolerance. You're just going to be diabetic. Okay? What we're referring to here is the possibility of preventing or delaying type 2 diabetes by altering lifestyle. So why is that the case? Well, in type 2 diabetes, I mentioned that the most common cause is obesity. And obesity makes the cells of our body insulin resistant. So if we're able to alter our eating habits and also increase our activity and lose weight, the cells around the body become sensitive to insulin again. So when we say impaired glucose tolerance, what we're really saying is, well, the cells are starting to show some insulin resistance, and we're starting to see just some mild increases in your serum glucose level. Okay, and we use the term pre-diabetic or impaired glucose tolerance. Okay, so this is really reserved for type 2 diabetes. And we can advise people that, you know what, we see the glucose is just a bit higher than normal. You're a bit overweight. Let's talk about what you're eating. Let's talk about a better diet for you. And let's talk about how you can lose some weight to make your cells sensitive to insulin again. And the type 2 diabetes has the ability to disappear. Okay? So really the lifestyle changes are centered around weight loss and increased exercise and changes in diet, because all of those things will increase insulin sensitivity of the cells, right? In particular, the weight loss. So say someone has type 2 diabetes. If they lose tremendous amounts of weight, through their diet and through exercise, the type 2 diabetes can actually be either better controlled or it could disappear and they wouldn't need the medications that they're on any longer. Okay? So when we're talking about pre-diabetic or impaired glucose tolerance, we're really talking about fasting sugars between 100 and 125. Okay? Or when someone goes for what's called a glucose tolerance test, meaning we get you to drink lots of sugar in an orange soda at the lab, and we test your glucose in your blood after you've had the sugary drink. Okay, and we can see that you're not really clearing the glucose in your bloodstream like a normal person with no insulin resistance. Okay, so impaired glucose tolerance is the term we use for this. Okay, so these people have the ability to turn the direction and get away from type 2 diabetes by altering their lifestyle. Okay, so let's talk about a blood test that we have available to us and is used very frequently in diabetics. So whether type 1 diabetes or type 2 diabetes. And it's a blood test that reflects the previous 3 months of serum glucose control. So it's called hemoglobin A1C, okay, or glycosylated hemoglobin. So what does this mean? So this measures the amount of glucose that's attached to your red blood cells in your bloodstream. So glycosylated hemoglobin. And the higher the number, the poorer control of your diabetes that you've had over the past 3 months. So we can actually see someone's 3-month control before they come into the office by doing a hemoglobin A1C. Okay? And this can be repeated on a regular basis to monitor the overall sugar control in the blood over the previous 3 months. Okay? So if someone has a very good level of hemoglobin A1C as a blood test, that means that they've had good control of serum glucose levels over the past 3 months. And if they're very elevated, we can tell the patient, listen, your blood glucose level is really poorly controlled. Let's do something about it. Let's adjust something in your medications or your exercise, your diet, or your weight, okay? So these can be used in type 1 or type 2 diabetes. Remember, type 1 diabetes is a younger person's disease that they get, and of course they have it for the rest of their lives. And they're totally dependent on insulin. Type 2 diabetes is typically as you get into your 40s, 50s, 60s, and so on. And classically, it's from weight gain. Okay? So that's why we really stress in type 2 diabetes lifestyle changes of, in particular, weight loss and your diet. Okay? Type 1 diabetics can be extremely thin. They don't have to be overweight at all, right? It's an autoimmune disease that destroyed their pancreatic beta cells.